Okay, so this lecture is going to be about nursing care and nutrition throughout a normal pregnancy. So we're going to begin with a little bit about the physiology of pregnancy, and then we'll move into how do we care for someone who is experiencing pregnancy. First of all, the average length of pregnancy is 40 weeks. We think of 9 months, but then 40 weeks doesn't translate into 9 months. It translates to 10 months. So months are a little bit more irregular measurements. So we measure pregnancy in weeks. It is divided into trimesters with first, second, and third trimester. There are changes to all body systems during the course of pregnancy. So we're going to start with what happens in the reproductive system and the breast. In the first trimester, the uterus grows, but it's the uterus that's growing. The embryo is still very, very tiny. The uterus grows because it gets more blood vessels, so increased vascularity, hyperplasia, and hypertrophy. So more cells, and also those muscle cells grow. So the uterine muscle tissue grows. And also we develop a thick velvety endometrium for that embryo to implant and develop. There are some things that may be seen on a speculum exam. Goodell sign is due to increased vascularity of the cervix. So when observed with a speculum, the cervix appears velvety and soft. The cervix is also more friable, so a little bit of spotting from cervical irritation is not uncommon. Chadwick's sign is when the cervix is bluish or purplish, and it happens around 6 to 8 weeks after fertilization. The cervix of a person who has never had a child is rounded. Okay, so the cervix looks like a round opening in a nulliparous person. Nullipara means a person who has never had a baby. A paracervix, so this is someone who's had a delivery before, appears slit-like because the dilation enough to allow for delivery changes the shape of that cervix. Leukorrhea is a heavier, normal, whitish discharge that appears early in pregnancy and it continues throughout pregnancy. Sometimes people will think that they have an infection when it's just the increased secretions that are normal in pregnancy. That happens because of increased vascularity. Got more vessels there, so more secretions. The pH of those secretions is more acidic than in the non-pregnant state. Increased vascularity also increases the sensitivity of the vagina and vulva. So increased libido is common. Now, sometimes in the first trimester, some of the discomforts, the fatigue and nausea can actually kind of suppress that. The second trimester is when we really see increased libido fairly frequently. Not that someone is abnormal if they don't experience that, but that's the most common time we're going to see increased libido. The breasts begin to feel fuller, they're more sensitive, and they start to feel heavier in the first trimester, and they may actually grow in size. In the second trimester, the uterus continues to grow. It becomes more round. Remember, it's kind of pear-shaped at first, and then it becomes more round or spherical. The walls get stronger and more elastic. And then toward the end of the second trimester, the uterus becomes more ovoid in shape. So it's kind of an oval shape, and it rises up out of the pelvis into the abdominal cavity. After about 14 weeks, the pregnancy may show. That's going to depend on the size of the person that's pregnant and on abdominal muscle tone. The fundus, the top of the uterus, may be palpable above the symphysis pubis from around 12 to 14 weeks. After about the 4th month, the person who is pregnant can feel contractions. They're called Braxton Hicks contractions. They're typically not regular. They tend to get progressively more frequent throughout pregnancy. Ballottement is about 16 to 18 weeks, and that's when on a digital vaginal exam, the examiner can tap the cervix and the embryo or the fetus will float up and then bounce back down and tap the cervix, and so that can be felt. It's ballottement. Quickening is when the person who is pregnant feels the movement for the first time. That can usually is around 14 to 16 weeks. If they've had a baby before in the first pregnancy, it can be later because they may have more muscle tone. They may not be as aware of the sensation. So closer to 18 weeks. The breast in the second and third trimesters continue to enlarge, especially in the first pregnancy, because the mammary glands are growing. Colostrum may be expressed as early as 16 weeks. In the third trimester, the uterus keeps growing. It rises to the level of the umbilicus at about 22 to 24 weeks, and it keeps on rising throughout pregnancy. As the fetus engages, so toward the end of pregnancy, when the fetus is moving down into the pelvis ready for delivery, then the fundus may actually appear to get lower. The fundal height decreases. The round ligament that holds the uterus in place has to get larger, has to enlarge to keep the uterus midline. Round ligament pain is actually a common discomfort in pregnancy because that heavy uterus is pulling and stretching the round ligament. Throughout this process, placental blood flow depends on perfusion. Okay, perfusion to the uterus is really important because the placenta has to be perfused in order for the fetus to receive oxygen, nutrients, and to be able to eliminate waste. Okay, in the next section, we're going to talk about cardiovascular, hematopoietic, and respiratory changes for the person who's pregnant.